You know, when we started this laser project, it was already in the year 2003, so about nearly 20 years ago. um, we had this idea to set up new devices, one for external laser therapy, but especially one for internal. And
Hmm.
especially we started with blood irradiation. And, you know, I want to get these devices approved, from the officially approved, you know, from our government, because there is no device like this on the market, you know, but we had thousands of studies, especially coming from Russia. 1978, the first publication was made in Russia from some two doctors, you know, and they reported about red laser treatment of the blood, and they used it first in cardiology. You know, they could show that the infarction, you know, after heart infarction, infarction area getting smaller, low sudden less sudden death of the people, less rhythm problems, everything. And these were the first to report, most in cardiology, but they used it also in chronic infections, especially like tuberculosis, something where there were not medication available for this, you know, septic shocks and everything. And later they expanded, you know, the indications to diabetes, especially, what is one of the biggest issue. And there are hundreds of studies, but the problem is nobody can read them because all written in Russian. And fortunately, this time I had a Russian assistant doctor coming from Lithuania, and he translated all these studies. And I said, the results are so fascinating, what they're writing. I want to get this device approved, you know, but you know, is our TÜV Germany like FDA in the US. And of course, they want to have studies and results and everything. So what did I do? I sent this doctor to Moscow, and he came back with a small Russian device with a plastic bag with 1,000 catheters. And then we made our own study first on my own patients. You know, I called my diabetic patients, my liver patients, high blood pressure patients. And then we generated maybe results on some 100 patients. And the results were amazing. We have seen the liver function was improved, diabetes was improved, blood pressure was improved. We could really prove it on the laboratory, you know, and that this is so fascinating, because blood irradiation has already a long history. The first one was done in the US, 1927, with the so-called Dr. Knott's device, where they took blood out, irradiated with UV light, and could see that they could improve the immune system and kill viruses, bacteria. So after this, I published the data in Germany, and then really, because the man who now made the approval and check of the company, he said, "Naya, you have not so many studies. You refer mostly on the Russian study, but this is so fascinating. I give you the approval." So we could start marketing it, and we sold a lot and got more and more and more results. This is only the history, you know. Um, Let me tell you something. You will ask me, or the patient, what is happening when we give light in the bloodstream. First of all, what I told you already, this American doctor, and this has a long tradition, taking blood out in chronic infection, for example, uh, irradiate the blood with the light and give it back to the body. It's a long procedure, and you know, it's time consuming. I did it myself many times. But this is more elegant, you know. We put only a small needle in a vein, put a sterile thin catheter inside, and connect it to a laser, and we can then bring all the spectral colors in direct contact with the flowing blood. So what is happening? Let's start with red laser. This has the longest history. Red laser can lead to a better deformability of red blood cells. So they can go better through the small, maybe nearly closed blood vessels. So improves the microcirculation. But the main issue is red laser stimulates the white blood cells. And we have a different white blood cells. You know, we have monocytes and B cells and T cells and everything. So they represent our immune system. So with the red laser, we have a huge immune stimulation. Also infrared, it's very similar. And later, 2 years later, we developed the first green laser. And green laser has an interesting effect. It delivers more oxygen to the hemoglobin. So the hemoglobin can take more oxygen. So improving the microcirculation, the blood flow, and more oxygen is exactly what we need, especially in all these complications of diabetes and heart people. The next step was we developed the blue one. And blue is amazing because blue increases the nitric oxide, and this leads to a huge vasodilatation in the body. And then 2 years ago, we developed the yellow one. What is yellow? Is like the sunshine in the body, In Chinese medicine, it deblocks, all the meridians, so it leads to more happiness and everything. But yellow also has a huge anti-inflammatory on the body. And the last development 1 year ago was ultraviolet light. And now we get back to the American studies. Ultraviolet can kill bacteria and viruses. Even we have the new studies killing COVID-19 with this. We can kill bacteria like Lyme disease, what Jennifer already spoke about it. So these are the general effect of the different lasers, but there is more. There is an effect on the cellular level. I want to say it a little bit easy, we produce our life energy in the cell. We know this. We burn the glucose and then we get the ATP, our life energy. So, when you look a little bit more in detail on this mitochondria, which integrated in the eukaryotic cells maybe a billion years ago, all these different parts in the mitochondria where the energy is produced are so-called chromophores. So they absorb light of the sun spectrum. And if you look on the different complexes, you find exactly the complete sun spectrum. So you can stimulate one complex with red infrared, one with blue, one with green, one with yellow. So we bring exactly this light back in the mitochondria, stimulate the cellular function, and of course the whole body. So this is something in short for intravenous laser therapy. So we have to regard it in general, and we have to look also a little bit more on the cellular level to provide the people with a lot of energy. And it's at the end, it's an anti-aging therapy. Everybody speaks about anti-aging, but there is nothing better than bringing all this light in the body.